Good morning, good afternoon, good evening, depending on where you are from. I'm Guyuron, and I'm delighted to be able to share some information about rhinoplasty with you this morning. In this presentation, I'm going to go through several things, and that would include who is a good candidate for rhinoplasty, how is that you select a plastic surgeon, how do we decide what needs to be done to the nose, and what do we do during the surgery? We'll talk about recovery, and I'll answer some great questions that some of you have asked already, and you can ask more questions. So deciding about the candidacy is an art for us and a challenge for the patients in some times. And we want to make sure that the patients have realistic expectation. For example, if a young lady has lost a boyfriend and wants to get the boyfriend back, doing a rhinoplasty is not going to resolve that. Or if there's a trouble in marriage, that's not going to be resolved with a rhinoplasty also. We want to make sure that the patients have enough understanding of what they need, what they want, and ultimately, it has to be the patient's decision. We don't want the parents to make a decision for a teenager, and we want the patient to decide. We don't want the husband to decide for the wife or vice versa. And also, it is important that there is a matching degree of concern related to the flaws that we see in the nose. Let me give you an example. If somebody is cannot go out because there's a little bit of asymmetry in the base of the nose or the nostril, that is not the right candidate for the surgery, because obviously the concerns are way out of proportion to the imperfections that we see. How do you select a plastic surgeon? Right? And that's again is an important factor. In fact, the most important decision that you're going to make for your nose surgery. Number one, you need to understand that rhinoplasty is the most complex operation in plastic surgery. I am a craniofacial trained surgeon, meaning I can take the facial bones apart, put them back. I can move the eyes apart, up and down. But even for me, rhinoplasty is the most complex operation that I do, because it is absolutely unforgiving, meaning even a quarter of a millimeter flaw can be seen. So we have to be absolutely precise. You need to make sure that the plastic surgeon whom you're seeing is a board certified by the American Board of Plastic Surgery. There are actually some ear nose specialists that do rhinoplasty, and they're quite capable. And experience is extremely important. And I cannot overemphasize this. And the reason is it takes time for us to figure out how to do a rhinoplasty. And some individuals cannot even get there because they don't have this operation done frequently by them. And it is quite important that you ask the doctor, how often do you do this? And we'll come back to that in a short while. You can look at the website, and this is an operation that a surgeon has to be passionate about it. And if that passion doesn't come across, it may not be, that person may not be the right choice for you. And obviously it is important to have a consultation in person or a virtual consultation. And we offer that actually. We've been doing that for the international patients, out of town patients, out of state patients for decades. And obviously in the this virus era, it has become actually part of life. And this is essentially what we are doing. But fortunately, it looks like we're getting back to normal pretty soon. And you need to review the pictures. Frankly, we all put pictures that are best, and patients have a lot on the website. If my website pictures are not good enough for you, then I'm not the right surgeon. And you have to analyze the pictures very carefully also, just to make sure that you're seeing the flaws, because obviously that all by itself is an art, to be able to see the flaws. And ultimately, you have to have a sense of comfort. In fact, it goes both ways. You have to have a sense of comfort with the surgeon. The surgeon has to have a sense of comfort with you. And how do we decide what needs to be done to the nose? This again comes in a variety of ways, and it is a constellation of facts that help us to decide what needs to be done to the nose. The first one is to listen to the patients. As a physician, it is an absolute must for us to listen to the patients, understand their concerns. And it's okay if the patients bring some pictures to us for us to see their taste. After all, the nose is something is part of the face that belongs to them, and we have to make sure that the patients guide us in the right direction as to what is going to please them. And I'm going to come back to that in a minute in a different way also. Analysis of the entire face. You see, the most important thing is for us to match the nose to the face. And as long as we do that, no matter how radical the surgery is, which we seldom do that, the nose is going to look natural. When you look at the person, you're not going to see that the nose has been altered. We examine the nose on the outside and internally. But more importantly, going back to early 1980s, I developed a system to analyze the nose and scientifically decide what needs to be done. In order to do that, we take life-size pictures of the patient on the front view and profile, and we analyze it scientifically using measurements and angles to create harmony between the different segments of the nose and harmony between the nose and the rest of the face, which is crucial to creating a nose that will look more natural. This is an illustration of some of the angles. There are about 16 steps that we go through to lead us to decide what alterations will suit that patient more precisely and the best way possible. And I share those pictures with the patients and show them what is that we're going to alter and how, especially in the profile, the pictures will look like. We also have capabilities to morph the pictures, meaning alter in the pictures in the computer, demonstrating some of the changes that we're going to make. Obviously, nobody can guarantee results, but it is the best way of communicating with the patient on their pictures rather than somebody else's pictures or some other people's pictures. The reality is that a nose that may look wonderful in a one face may not fit the other face. This is the scientific way of deciding what needs to be done, and we take away that prototype nose that used to be the standard going back to 80s, even sometime in 90s. We have gotten away from that. If you go to my website and look at the pictures that I'm going to show you today, not two noses are alike because they're not two faces that are exactly alike, unless they're family members, sisters, twin sisters, twin brothers. The noses should not look very similar. So what is that we do? Number one, this is a procedure that is done under anesthesia and during the surgery, and I'll come back to that in a second. What we do is through a tiny incision in this area, in the column in between the nostrils, which is called an open technique. We lift up the skin and alter the underlying frame. The, the incision will continue inside the nose, but you don't see that from the outside. And what we do is alter the frame by removing some of the redundant skin, some of the redundant cartilage, extra protruding hump, which is a piece of cartilage and bone. Move the bones closer together if we need it. Narrow the tip cartilages so we can create a better definition, more pleasing definition. Use some support on many noses. The tip is hanging, and we need to make it stronger. To do that, we actually use the patient's own cartilage from inside the nose, which is called the septum. There's a wall partition inside the nose that's called the septum. And if the nostril is retracted, we add more support, and that helps the breathing as well. And if we need to narrow the nostrils, we make a tiny incision at the base of the nostril where the nostril joins the face. So the incision or cut falls in the crease, and after it heals, you really have to look for it to be able to see it. With the patients that I'm going to show you, almost all of them had that kind of incision, but you will see that they're not discernible, they're not noticeable. Let's talk about the recovery. Many of the patients have some degree of swelling and bruising. And with the abundance of experience, we can actually minimize this. We can't control the bruising and bleeding or swelling completely, but those of us who have done enough of these, the minute we lift up the skin, we know that it's a patient who's going to bruise or bleed. We give them medications during the surgery to minimize the bruising and swelling. Pain is not severe after this operation. The night of surgery, the patient may have some throbbing, some pain, but we give pain medications that we keep them comfortable, and that's part of our responsibility. Patients who have had surgery, rhinoplasty, should not be exercising heavily for 3 weeks. Walking is encouraged, actually. They can walk, but we tell them not to exercise strenuously. And a group of medications that are called NSAIDs, like aspirin type medications, are forbidden for 3 weeks before, a week after the surgery. We tell the patients not to wear any glasses because we don't want any pressure on the nose for 5 weeks after the surgery. Complications after this operation can occur, but they're extremely rare. Infection, bleeding may occur, but those are very unlikely. Everybody experiences some numbness in the nose. That's part of the course, but that's not a complication. It usually does go away. There's a remote chance that the numbness may not go away completely, but I've never had a patient to complain about that on a permanent basis. And it is going to take about a year for us to see the final outcome. And depending on the thickness of the skin, that may actually be 2 or 3 years. However, every patient will see some benefit from the surgery soon after we remove the bandages. And the bandages will stay on 7-8 days, and there'll be 2 tubes inside the nose. I don't use packing after the surgery. And those bandages, again, will be removed in 7-8 days. Majority of my patients look presentable right after the bandages come off, meaning on the 8th day, they can resume their social calendar, go back to work if they want to, so long as their job is not, again, strenuous. Let's share some patient results with you. And you can see that this patient has a large hump that is deviated to the right, at the patient's right, and the tip is too wide. And if you compare this, you can see now the nose is straight and the tip has been narrowed. It looks pretty, but it doesn't look like this patient has surgery. Again, the hump is gone, And here we see the profile, quarter view, and basilar view. Let me make sure you understand the importance of these views in the websites that you look at. Even it is by log, we're going to have a patient that is going to look great on the profile or front view, but when you don't see all dimensions of the nose, you're not seeing the entire reality. So please make sure that when you look at the pictures in the doctor's office or in the website, there are at least 2 or 3 views, not just one view, one profile, one front view. So here's another patient with the hair lift or cleft lip, and these are the patients that are extremely challenging in terms of creating tip definition. And here she is after the surgery, and you can see on the her nose in the profile. I also did a chin surgery on her. I brought her chin forward, and you can see how much projection we have created for her. The hump is gone, and we have created a more balance to the profile compared to this convex face. The patient, another patient with a large hump with deviation of the entire nose of the patient's left. And when you compare the before and after, you can see the nose is straight. All the adjustments have been made. There's a strong masculine nose that goes with the face. Doesn't look like he has surgery. The flaws have been eliminated. That is the key thing to the success of the operation. And we need to create noses that again look pleasing but natural. It's a patient who has significant excess width to the nose. In this area, you can see it has been narrowed. The nose looks prettier. She looks less angered. Obviously, we have done also a forehead procedure on her to take away this line at the same time. And the profile has not been changed drastically because she really didn't need that to be changed. And here's a patient who had nose operation previously after an accident. And you can see nothing is in the right position. And here's a reconstruction after placing her own rib cartilage under the skin and using some more soft tissues to make her look better on the front view, profile, quarter view, and the basilar view. So those are just the patients have allowed us to share their pictures in the internet or where other patients. Obviously, in my office, we have more patients that they have allowed us to share their pictures in the office, but they won't allow us to put it on the website. And we never use anybody's picture without the consent. So let's get back to the questions some of you asked. Do you use autologous cartilage? The answer is yes. Actually, most of the time I use the person's own cartilage, and the individuals have had nose surgeries before. In my practice, they never need a rib cartilage or ear cartilage. On the other hand, patients have had surgery and they had the cartilage from the septum has been removed. Those are the patients that they may need cartilage. I prefer their own cartilage, but I don't feel strongly about it. We do have cartilage available in the bank that has been, these pieces have been processed medically, so it can be used, and they're off the shelf, or we are after freezer actually. So we can use those pieces of cartilage if somebody doesn't want any incisions. If we need to use cartilage, if it is behind here, the incision is behind here. If we use rib cartilage, it'll be small cartilage right under the breast in the crease for a lady. Obviously, it would be a little bit more noticeable for a male patient. How many rhinoplasty procedures you perform in a year? I do over 100 cases a year, and I have done tens of thousands of rhinoplasties. Again, this is a passion for me, and that's a key question. Actually, is a very intelligent question, because if somebody is doing rhinoplasty once in a while, it is impossible to create reliable, predictable results consistently. Will I have packing? No, as I mentioned, I don't use packings in the nose. I use small tubes that they are inside the nose. You can't see them from the outside. They are removed in 7-8 days, as I mentioned. What nasal features will make rhinoplasty more complex? Probably the biggest challenge for us is dealing with the noses that they have really thick skin. But even that type of nose can be improved enough to be worthwhile. We may not get a perfect outcome, but there's going to be probably 90% improvement, 85% improvement. And those are the noses that actually keep getting better with time. How do you determine if I will have open or closed rhinoplasty? I used to do all of my rhinoplasties through closed technique for the first 10 years of my practice. I gradually transitioned to open technique. And today, I would say almost all of my rhinoplasties are open. And it's not just me. Many of us who teach rhinoplasty internationally prefer open technique because we can see the anatomy precisely. We can correct the problems precisely. It's not to say that a closed technique is wrong. In my view, open technique is much more predictable. How young is too young for rhinoplasty? This is another great question. Because teenagers actually are so sensitive to their appearance that I think it is crucial we correct the problem in early age and take away that scar from the nose that may not go away after years if we delay the operation too long. For that reason, my youngest female would be age for the operation rhinoplasty is 13. For a male is 14. But sometimes we do this operation even an earlier time if absolutely necessary, but those are extremely rare. That's the sort of an ideal age because that's the age that they become very engaged with their faces, and we want again to avoid long-term consequences. So in summary, I have shared some information about rhinoplasty with you and answered some questions, and I hope that this was educational for you. Thank you for your attention.